Hello, and welcome to this overview of Leading in Gold Standard Science, the NIH Implementation Plan that recently dropped last Friday. In this, I'll have an overview of this plan, kind of going over what I think are the key points and other important materials in this. So, as outlined at the beginning of this plan, the NIH mission, National Institutes of Health. Their mission is to seek fundamental knowledge about the nature and behavior of living systems and apply that knowledge to enhance health, lengthen life, and reduce illness and disability. So at the heart of this is the mission for gold standard science. And so this plan outlines accomplishments so far in that gold standard science and presenting visions for the future. And the new director of the NIH, Dr. Jay Bhattacharya, has a quote here at the beginning. Gold standard science isn't just what we strive for, it's embedded in everything we do, from the research we support to the policies and programs we create. So, what is gold standard science according to this NIH plan? Well, there's 9 characteristics. Gold standard science is reproducible, transparent, communicative of error and uncertainty, collaborative, and interdisciplinary, skeptical of its findings and assumptions, structured for falsifiability of hypotheses, subject to unbiased peer review, accepting of negative results as positive outcomes, and without conflicts of interest. So I'll spend this overview looking at each of these characteristics, pulling out from the document what I think are the key points, some of the best or most noteworthy current efforts, and planned efforts. So this isn't an exhaustive list. It's more just an overview, again, of what I think are the most important bits. I don't go over every effort. So if you want to dig more into it yourself, you can certainly look at the document. So let's get started. The first piece here, this first characteristic is reproducible. So gold standard science is reproducible. So the key point, I think, from this is the definitions of reproducibility and replicability, which are slightly different. Reproducibility are that experimental findings are generalizable and robust across different approaches. So you can use different systems, use different methods approaching this issue and get the same general result. So it's robust. It's not just very finicky to one experiment type. Now, replicability, which is usually when we think of reproducible, is the more dominant form, is where you actually run an experiment at the same time using the same methods, same conditions to get the same results. If it's, I know a big issue in biomedical science and other sciences is the replication crisis. A lot of these studies aren't replicable, even if using the same methods and conditions. So it's definitely a huge issue to make science gold standard, to make it reproducible. So what is the NIH doing? What are some of their current efforts? Well, they have this replication initiative for preclinical, translational, and technology development research. These are from the NIH Common Fund programs to really try to make things reproducible and some of these important studies to be done again to make sure they are reproducible. They also have training and support on gold standard data sharing efforts. Whereas now looking for the future, the plan efforts, they're looking at new strategies for reproducible and replicable biomedical approaches. So they're looking at new funding mechanisms, new funding opportunities across the research enterprise to deal with this issue of reproducibility. They also going to have more support for data reproduction and replication, and really focus on sharing negative or null results, because those are important too, and we'll see that later on as well. All right, number 2, gold standard science is transparent. Key points here is that NIH is working to usher in an era of radical transparency, and their efforts to be transparent are found throughout the research life cycle, from peer review, public posting of active rewards, requirements for sharing data, and more. So current efforts, there's a lot going on. They've made sure they've published their review criteria to understand the factors that grant applications are evaluated for scientific and technical merit. And actually, along with that, beginning in this January 2025, they released a simplified peer review framework to address streamlining that process. There's also things like the NIH data book, which shows like grant success rates, research workforce, small business grants, and other topics, helpful information on how grants are actually funded, how many are, etc. There's also this is one of the newer ones, the NIH Public Access Policy, which is now in effect as of July 2025. It's to provide unrestricted access to scientific results and publications produced by NIH-funded investigators. And also, there's the longstanding research tools policy to ensure that unique tools developed from NIH-funded research are available to the research community. Some upcoming efforts. There is planned review of biosafety and biosecurity in life science research, making sure there's trust and transparency there. And NIH is also looking at adopting the Arrive Essential 10 framework for animal research. Arrive Essential 10, it's the basic minimum information to include in a manuscript that allows readers to assess the reliability and findings of a study, like sample size, outcome measures, or descriptive statistics. All right, number 3, communicative of error and uncertainty. So gold standard science is communicative of error and uncertainty. Key points: when translating from research to health outcomes, good translation is predicated on the quality, objectivity, utility, and integrity of the information disseminated to the public. You need good communication, honest communication. And this requires disclosures of uncertainty, so limitations, variability, potential sources of error, or limitations in measurements of research findings. So that's a really important point. So current efforts, big thing they have is the guidelines and policies for the conduct of research, which covers the entire research process. Make sure you know how to conduct research and communicate it, especially with things like hypothesis generation, experimental design, analyzing and interpreting data. Now, a big push that NIH is looking for on their plan efforts is prioritizing academic freedom, especially in the cases where scientists are pursuing evidence that might be inconvenient or objectionable, or at least perceived that way. And they want to prioritize this across the agency to make sure that there can be academic discourse without these big 3 things, without fear of official interference, without fear of professional disadvantage, and without fear of workplace retaliation. And a lot of this is to make sure that the NIH is strengthening public trust. There's really been a hit in the last, I think, several years with public trust of institutions, including the NIH. And ultimately, the NIH needs to be responsive to the public. That's where ultimately they get their funding. So the NIH is really wanting to strengthen public trust. And this characteristic, number 3, is one of those ways. All right, let's move on to number 4. Gold standard science is collaborative and interdisciplinary. So key points: the NIH champions effective collaborations for the advancements of scientific research, and they have some examples of what they're doing on their level, like cross-disciplinary projects, collaborating with other federal agencies, and collaborating with private entities. Some current efforts, they're really encouraging interdisciplinary teams. And they also have this HHS, so Health and Human Services Collaborations Report, where they show where the NIH collaborates with other HHS agencies. Now, some planned efforts. They have new collaborative initiatives that they hope to launch that address urgent research and health issues for today. So a couple examples is a collaboration with Medicaid and Medicare services to look at the root causes of autism spectrum disorder, and a partnership with the FDA, Food and Drug Administration, on making Americans' foods and diets healthier, so nutrition research. All right, number 5. Gold standard science is skeptical of its finding and assumptions. Key points is the NIH wants to allow constructive skepticism, so scientific findings and assumptions are open to evaluation and critical assessment. They're not just simply handed down or broadcast as if they are the only thing. The NIH really wants the truth to come out. And so they want to advance open-minded and impartial science, science that can be questioned, science can be sifted, science that isn't the final word, but a word. So current efforts, they have processes and policies that allow for challenges to scientific conclusions at all levels, and some planned efforts. They have an interest in a comprehensive review of policies and practices to ensure academic freedom is the rule, not the exception. So going back to an earlier point here about academic freedom. And this interesting thing they have working on is this pilot NIH Science of Science Scholars Program. Now, as an Aristotelian might clean that language up a little bit and describe it as maybe not a science of science scholars, but a philosopher of nature, or philosopher of science, more accurately. But however you call it, the science of science scholars or philosophy of science really looks at getting researchers to analyze internal NIH administrative data to evaluate NIH contributions and impact to biomedical research, to be able to optimize NIH investments and ensure scientific quality, rigor, and reproducibility. Okay, number 6. Gold standard science is structured for falsifiability of hypotheses. So key point is for effective falsifiability, studies need to have precise testable hypotheses, experiments with measurable outcomes, and rigorous methodologies. Examples of rigorous methodologies are controlled experiments, randomized trials, or advanced statistical tests. Really, the idea is if you can't falsify your hypothesis, you're probably not doing good science or even, in fact, science at all. So some current efforts there have an updated grant review criteria, looking at the rigor of prior research, rigorous experimental design for robust and unbiased results, consideration of relevant biological variables, and authentication of key biological and chemical resources. Another interesting effort ongoing is this NIH preprint pilot, which is to make preprints resulting from research funded by NIH available at PubMed Central. So you can get those out there even before peer review, so people can already look at them, see what the merits are without having to wait for publication to be finalized. And some planned efforts in collaboration with the FDA, the NIH is launching this Modernizing Research and Evidence glossary. More than 40 clinical research terms and definitions used to describe design methods and analysis and interpretation of innovative clinical study designs. Number 7, gold standard science is subject to unbiased peer review. So the NIH has a complementary suite of efforts to ensure that it funds the highest quality research free from influence or bias. And really, they want to protect the public's investment in biomedical research from bias and build public trust. Again, we see the NIH is interested in building public trust to show that, yeah, the NIH wants to be good stewards of the public's resources. So current efforts, 80% of the budget in biomedical research supports extramural researchers from every state in the country, all sorts of institutions. And a current effort, we've talked about this before, but they have a simplified framework for NIH peer review criteria. Planned efforts, they're planning to actually centralize the initial peer review processes for all applications for grants, cooperative agreements, and research and development contracts to really streamline that process. Number 8, gold standard science is accepting of negative results as positive outcomes. And we saw this all the way in the first characteristics of more negative or null results. Some key points is that the NIH thinks that null and negative results are vital for scientific progress, and indeed they are. And so they want to prioritize developing new resources to really change the culture in biomedical enterprise to show that negative results are valuable scientific outcomes. So current efforts, they already have expectations of funded research to use data repositories regardless of publication status. You can put null results in a repository without having to try to fight through publication. And they want to make sure that researchers transparently report all outcomes, even if they're null, even if they're negative, because that adds to the scientific literature, that adds a scientific process. And a planned effort they have is to launch new groundbreaking initiatives to solve this multifaceted issue of publication bias. Publication bias being the preferential dissemination of statistically significant or otherwise exciting studies, especially in published journals. All right, and 9, gold standard science is without conflicts of interest. So they really want to manage, the NIH wants to manage real or apparent conflicts of interest among NIH-funded scientists and its staff, and they find that vital to the integrity of biomedical research. And again, they're striving to address the public and assure the public of its commitment to advancing unbiased science, that they want to make sure, that science isn't hijacked, science isn't biased, it is for the public's good and as transparent and as few conflicts of interest as possible. So current efforts, institutions and investigators that are funded by NIH are required to comply with financial conflict of interest requirements and to disclose all sorts of research support. In the future, they want to strengthen disclosure mechanisms, and they have continuous updating of training modules from the NIH ethics program. All right, with that, here are some references. Of course, again, this was just an overview. I didn't go through everything. I just went through what I thought were the most important points to pull out. You can, of course, read the article yourself here and Leading in Gold Standard Science, and should be available in the description to this video as well. There's also other links that they talk about that I think are important, like the replication initiative, the various review criteria and framework, various policies, guidelines, a collaboration report, and different pilots. So with that, I guess I'll close with my own attempt for gold standard science and communication, part of Transcend supported by NIH through the National Institutes of General Medical Sciences under our project number. So if you find this useful, you can certainly cite us and you can check us out on Transcend. So the NIH, in closing, the NIH is striving for gold standard science. Transcend, to the best of our ability, is striving for gold standard science. Myself, Mark Williamson, as a scientist, is striving for gold standard science. So hopefully this overview was useful, and have a gold standard day.